So I think the most important part of this study was when we looked at men who reported difficulty falling asleep, and men who reported more difficulty falling asleep compared to men who had no difficulty falling asleep had worse IPSS scores. Men who had more difficulty falling asleep had an IPSS of 7.1 compared to a 4.9 in men who had no difficulty falling asleep. And I think that's really the big take-home.
See the data as it was laid out really sort of puts it in hand that we need to just focus. We always ask questions of what kind of work do you do and so on and so forth, but the questions usually stop at that point. Now it's taking it the next step of, okay, so what shift are you working? When do you go to sleep? And there are a number of different sleep disorders, and this may again become an impetus to really start identifying those patients who have disorders and then getting them to people where necessary who actually deal with sleep disorders.
Well, I think it tells a urologist that LUTS are not just a problem with staying asleep. It's not just men waking up in the middle of the night to go urinate, but actually difficulties with sleep may actually impact their lower urinary tract symptoms. So discussing with men, what are your sleep habits, how do you get to sleep at night, and what can you do to improve those things may have an impact on their LUTS.
These men need to be counseled regarding how to optimize their sleep, and I think a bigger emphasis needs to be put on their sleep patterns, how to make them more normal and more conducive to having fewer problems build up, as Dr. Adler had mentioned and Jason had mentioned as well. And also from the other side, the bidirectional aspect of it, to address the LUTS both directly and indirectly by a more holistic approach to the patient. One of the things that's become apparent to me when we approach our patients as urologists is to not compartmentalize our patients too much, to approach them more generally and ask more questions about not necessarily who they are, but how they interact with the world, in order to identify factors other than their specific problem which they may be seeing us for, that we can help address if we're the first ones to see them.
The impact on sleep and how that ties into urinary symptoms hasn't really been studied, and this paper takes a nice starting look at that and opens the door to conversation for physicians to have with their patients. As has been said, Jason Scoville, and certainly in the literature that I looked at, we know that non-standard shift work and impaired sleep patterns affects many aspects of a patient's health. And as Dr. Pastuszak said, that we need to sort of look at the overall patient, not compartmentalize into, okay, we're focusing on the urinary system, things like that. We need to really look at the whole bigger picture.
So I hope over the next couple of years we start to recognize that shift work is a big problem, but shift workers do comprise 15 to 25% of the 15 to 25% of the U.S. workforce, and I don't think that there's really anything that we're going to be able to do to change that. So I think it's just important as urologists and physicians to understand that this is a health problem and talk to patients with how they can sort of mitigate these health issues.